So we'll continue with digestive disorders by looking at the upper GI tract disorders. So it starts with the mouth. So there's congenital abnormalities can happen in the mouth. The mouth is formed early, 6th to 7th week of gestation. We can end up with abnormalities in the formation. Cleft lips, cleft palates seem to be the biggest thing. Probably multiple factors, but it develops early in gestation. The problem with it is feeding problems with the infant, because if the palate has got an opening, then as the baby sucks to feed, it can aspirate milk into the respiratory passages. Speech development can be impaired because the mouth can't shape and form the vowels and the phenomes properly. We seldom see it anymore. We see it in infants, but the surgical repairs are done quickly. In third world countries, we see it a lot more. And then there's all kinds of therapy. This is very aggressively treated in North America. So it looks like this. There's a cleft palate, so you'll notice that the gums, the teeth, the lips are correct, but there's the palate is bifid, it's open. We can have inflammatory disorders of the mouth. So one of the most common inflammatory lesions is an Aphthosis ulcer, which is really just a canker. Strep may be involved. They're small, tender, painful lesions on the floor of the mouth, on the soft palate, on the lateral borders of the tongue. They usually heal spontaneously. You can put things on them, that little drops that help. People that are immunocompromised are probably more susceptible to them. They look like that. There's one on the lips, so it's just a canker sore. Another common thing is thrush candiditises. So this is Candida albicans. It's usually, there's a little bit in the mouth, but you can get an opportunistic infection of it. And we call it thrush. Immunocompromised people and people with diabetes are prone to it. So people that are taking immunosuppressive drugs for a transplant take a lot of prednisone and often have diabetes, iatrogenic Cushing's, so a diabetes type syndrome, and are immunosuppressed, so are immunocompromised. So they are particularly prone to thrush. People that take broad spectrum antibiotics, so oftentimes when we don't know what the infection is, we give a real broad spectrum antibiotic. Cancer therapy, it's fairly common because immunocompromise happens because of that. It gets red and swollen, and this white, cheesy material kind of grows on the surface of it. It's because it's a yeast infection. Babies sometimes are prone to thrush as well, for some reason. It looks like this on the tongue. Some people get it, it's called geographic tongue, they get it in patches. This is what it looks like under a microscope. And it's usually dealt with some sort of antifungal mouthwash. Cold sores, herpes simplex type 1. It's just a simple cold sore. They're quite common. They're transmitted through close contact, kissing. The virus gets into the epithelial cells, the natural killer cells and the T lymphocytes kill those cells to get rid of the virus, and they leave a lesion, they leave an open sore that will ooze, form a blister. That interstitial fluid that oozes will contain the virus, and that's why it's contagious. It's itchy and it's painful, and people tend to touch it, get that fluid on their fingers, and then touch someplace else, and you can auto-inoculate other places. They usually last about a week, and then the lesion goes away. But in the time that it's there, after you've caught the first one, the virus enters the neurons, the sensory neurons, and that's why it tingles, because the sensory neurons are being irritated. And the virus ascends via the retrograde transport and takes up residence in the cell body, in the sensory ganglion. When that happens, we can't get at it. Like our immune system, the natural killer cells, and T lymphocytes won't kill our neurons. So now it's like a safe place for this virus to live. In times of stress, or opportunistically because of other infections, so physiological stress, psychological stress, stress from just being cold, so that's a physiological stress, then this virus can migrate out and reinfect the epithelial cells, and you get another cold sore. The biggest fear of this is if you auto-inoculate, you get it on your fingers and you touch your eye, it can become a conjunctivitis or keratitis, which we've talked about. And it's recurrent. We use antiviral meds to control the acute outbreaks of it, but we can't control the chronic. So cold sore looks like that. Less common because of antibiotic therapies now is syphilis. Syphilis can cause oral lesions that are really very contagious. The first thing that happens, so primary syphilis, you get painless ulcers on your lips and your palate and your tongue. They're called syphilitic cankers. They're not to be confused with the other cankers, but it is an ulcerative lesion. There is a dead center to it. A couple of weeks later, they're gone. It then comes back and you get these red macules, or it can be papules, on the palate, usually. Very highly infectious. But it heals spontaneously. We can treat that with penicillin. Tertiary syphilis becomes a neurological lesion and doesn't treat very well. So it's important it gets treated in the primary or secondary stage. And it's the primary and secondary that are the contagious stages. So syphilitic canker, it looks like that. It's on the tongue. Dental problems include caries, which is cavities. Usually it's Streptococcus mutans, Lactobacillus. The thing about Lactobacillus is that they are anaerobic bacteria that when they make their ATP, the byproduct is lactic acid, which is acidic, and the lactic acid dissolves the minerals in the tooth enamel and causes the erosion. The more sugar there is, the more lactic acid is produced, and so that's why sugar is a culprit, and so are other acids. So drinking acidic sugary drinks like pop with carbonic acid and lots of sugar is not good for your teeth. Fluoride is what we use because that seems to kill the lactobacillus. And hygiene and avoiding frequent intakes of sugars and acidic things. Gingivitis is gum disease. It's inflammation. The tissues become red and swollen, and they bleed easily. If you are spotting blood when you brush your teeth, you probably have the beginnings of gingivitis. Accumulation of plaque at the root of the tooth or at the collar of the tooth can irritate just physically irritate the gums and cause gingivitis. It's usually got to do with inadequate oral hygiene. So if you're brushing twice a day, shouldn't be too bad, except that if you are excessively brushing, then you can cause gingivitis because of the trauma of the toothbrush. The idea is that you want to clean your teeth, not wear grooves in your teeth, because you get increased plaque retention. There's a ligament that holds the root of the tooth into the alveolar margin of the jaw, called the periodontal ligament, and there's the periodontal parts of the bone that surround the root of the tooth. And these can get diseased, infected. Gingivitis is usually the start because the gingivitis creates a situation where you can get opportunistic infections. It's usually got to do with poor dental hygiene. And literally the root of the tooth can loosen and fall right out. I remember a guy that I used to work with. He was just talking, and he got a funny look on his face and spit a tooth out into his hand, and the root was attached and everything. It was really wild. And so he had periodontal disease, and it was one of his front upper incisors, so he had this little gap tooth smile. It was very odd because he wasn't eating anything and the tooth didn't crack or anything like that. He was just talking to me and another guy, and boom, the tooth fell out. So he had to see a dentist immediately and had that same tooth put back in, and they worked on it and managed to take. But we're not going to dive deep into it. There's all kinds of different categories of periodontal disease. Sometimes they're iatrogenic, sometimes they're systemic disease, sometimes it's just oral hygiene. So here's some healthy teeth. Here's a particularly bad. Here's a mouth you don't want to kiss. So Periodontist Dantitis occurs usually by organisms traveling to that area via blood vessels in the gums. The bone reabsorbs, the ligaments loosen or get reabsorbed and they're missing, and the tooth will fall out. Generally speaking, if one falls out, then the neighbors are probably in trouble too. Hyperkeratosis is a condition where, just what it sounds like, the mucosa, the keratinocytes in the mucosa build up. So leukoplakia is a type on the buccal mucosa, so on the inside of the cheeks, on the palate, on the lip. It's probably got to do with chronic irritation. So smoking is a big problem here. Things that chronically irritate the mucosa because they're keratinocytes, and irritation causes them to thicken, just like everywhere else. The biggest problem is then we start to get dysplastic cells, and it can become a squamous cell carcinoma. So when it's seen, it should be attended to. So you will notice that not only is the leukoplakia here, but there's a fair amount of plaque on the teeth, and oral hygiene doesn't look the best with this person. Here it is on the side of the tongue. So, like I said, this can develop into squamous cell carcinoma because the keratinocytes are squamous cell. It usually takes years of irritation for the dysplasia and for it to become carcinoma. So it's usually people over 40. it's got to do with repetitive irritation. So smokers, alcohol abuse, so it happens on the lateral borders of the tongue and on the floor of the mouth. You can get Kaposi sarcomas if you have AIDS. If it happens on the lips, it has a better prognosis, probably because it can be cut out, and usually because it is seen, so it's attended to. Almost all the cancers, the earlier you catch it, the better. So there's a squamous cell on the floor of the mouth under the tongue. The thing about most pathology textbooks is that it's almost like a given that you're going to have gross pictures. There's some Kaposi sarcomas. They're on the top of the gums, particularly nasty there.